This St. Patrick's Day weekend, the Portland Bureau of Transportation wants to make it a lot easier for you to celebrate safely. From March 14th through the 17th, they're offering discounted taxi and rideshare service rides. So if you're heading to the Cal's Portland Irish Festival on the waterfront, ask any employee and they'll give you a taxi coupon good for up to $20 off one ride. You can also hit up PBOT's website for coupon codes to get $10 off one Lyft or Uber ride within our city limits. Remember, it's never safe to drive impaired, so either let TriMet do the driving or let PBOT help you pay for your ride home. More details at portland.gov/transportation. Just a note for our listeners that in speaking about our state's struggle with caring for those experiencing severe mental illness, today's show mentions suicide and family violence. Our country has a terrible history of providing proper care for those suffering from severe mental illness, including often using mental health facilities to lock away anyone not conforming to society's norms and expectations. And rightfully so, civil commitment, which is court-ordered involuntary treatment, is especially controversial. States have struggled to find the appropriate balance between respecting individual rights and offering life-saving care. But some are saying Oregon has ended up tipping too much on the side that ends up neglecting those who need the help the most. So today on CityCast Portland, we're talking with KOIN investigative reporter Elise Haas. She's been covering two new bills written by the Oregon chapter of the National Alliance on Mental Illness, or NAMI. They're hoping to reform our state's civil commitment process and expand mental health treatment facilities. Elise is walking us through why these bills are needed and why they're also being opposed. It's Tuesday, March 12th. I'm Claudia Meza, and this is what Portland's talking about. Elise, you don't even know how long I've wanted this topic to be covered by the podcast. It's been something that, since last year, maybe, I've been pushing, but no one has covered it as extensively as you have. So thank you.
No, yeah, certainly. I started getting really interested in it in 2022 after I met some mothers who, lost their children because I couldn't get them the treatment that they needed, whether they lost them to the streets or lost them to the criminal justice system in jail, etc. When you start to hear these personal stories and you start to wonder, why is this happening? How is it happening? Then, yeah, I totally understand why you're interested in it, too, because it touches everybody. We see it out on the streets. Everybody probably knows somebody who has a family member or a loved one with mental illness.
Yeah, and I'm just going to be very candid. My brother is schizophrenic, and he also suffers from anosognosia, which I've never heard of, by the way. I've never heard this term. Could you explain what that term is?
Absolutely. So anosognosia is something that I brought up in one of my most recent articles. And it is actually when somebody has the inability to recognize their own mental illness. And so naturally, if somebody doesn't think that they are sick, then they are very unlikely to volunteer to get mental health treatment. And that can pose a lot of problems with trying to get healthy again. So anosognosia is very common in some of the peer-reviewed research that I've read, very common in people who are on the schizophrenic spectrum, who are currently in a state of psychosis, but also it can affect some people who are on the bipolar spectrum as well.
Yeah, and I think a lot of people don't understand how hard it is for families with schizophrenic loved ones. You can't force them to take their medication.
Correct.
And you also can't make them feel like you're trying to force them because things could get violent. And I don't think many people quite understand this. Like they're just seeing it in a civil liberties kind of way, but it's just no, this is life and death in so many ways, But I know we're going to get into all this. I just wanted to give that disclaimer at the top. So when someone is listening, they kind of just know where I'm personally coming from. But I know that you've been looking at this through the lens of two bills. And I'm curious if Oregon is unique to other states in that we have stricter laws and stipulations surrounding involuntary commitment. And I ask because of these two bills, because from what I gathered in your article, it appears that it's pretty difficult for family members of someone experiencing psychosis to get any kind of substantive or even long-term medical care, even if this person is a clear danger to themselves or others.
Yeah, so at this point, it is very difficult to get somebody involuntary civilly committed or involuntary mental health care treatment in Oregon, and you have to be about to kill yourself or somebody else. So you're right in that regard. So where does Oregon stand in regards to how it compares to other states and its level of strictness? It's a great question. It's not necessarily one that's easy to answer, but I'm going to be as transparent as possible when I speak about it. So Disability Rights Oregon, I've spoken to them about this issue at length. Clearly, they're a nonprofit that advocates for people with disabilities. Their attorneys have looked at all of the language across all 50 states, and they have found that Oregon is far from the strictest, that we're somewhere in the middle. However, as a journalist, I will say that I have not been able to independently verify that information with my own attorneys or anything like that. But for the purposes of this conversation, I do think that it's a good starting point to go with Disability Rights Oregon's findings. Also, I do have a spreadsheet with all 50 states and lists all of the criteria that each state has to get somebody into mental health care treatment. And I'm a layperson, I'm a journalist, I'm not an attorney, but I can look at this text, right, and see some clear differences. So Oregon's is like a sentence or two and says, you know, you need to be a danger to yourself and others and unable to meet basic needs. But then if I compare it to something like Utah or Pennsylvania, they'll have like a page long that is very explicitly defining the risks like suicide, serious bodily harm, harmful sexual conduct, severe mental and emotional distress leading to functional decline. They will then list actual criteria for not being able to meet basic needs, saying like food, shelter, clothing. And so that's the type of language that exists in other states that makes it less vague. So here's the thing. Let's just go ahead and say that Disability Rights Oregon's, attorneys are correct, and that Oregon is just somewhere in the middle based off of the language that we currently have. But the courts over the years have done all of these rulings that set a precedent. Now the bar is so high that, like I said, you have to be about to kill yourself or kill somebody else in order to be civilly committed here in this state. Mix in another problem. Oregon, as we've long reported on, ranks near the bottom in access to mental health care. In 2022, when I first started reporting on this, Oregon ranked 49th. In 2024, Oregon's now 47th. So that combination really leads to these tragic cases where families can't get loved ones civilly committed or involuntary mental health treatment or just proper treatment in general.
Yeah, and I was reading through your article. You gave a couple of examples of people's personal stories. And I think that something that didn't connect with me, because when I hear, oh, if you are a danger to yourself or to others, you're like, well, that should be enough. But there were these stories where it was very clear that this person was a danger to themselves and others, but it's almost like legally speaking, they wouldn't be able to do much unless someone survived an attack or survived a suicide. And it's like, that's a lot of luck that someone's going to survive a loved one trying to kill them or survive their own suicide. That's our best hope.
Yeah. I'm glad that you brought that up because when we say danger to themselves and others, we as everyday people, we think that we can come up with our own interpretation, but they literally have to physically be in the act of doing that. The physical act has to be happening in that moment in order to say, yes, that person is in danger. So the cases that I talked about, we had families whose child died by suicide, and then another case where there was homicide. So this case in particular, there was a father named Hunter Graham, and he tells the tragic story of his son, Austin, who during a psychotic episode killed his mother, Teresa. And since then, recently, a judge has now committed Austin, found him guilty except for insanity, and has committed him to the Oregon State Hospital for life. And this is despite years of efforts of this family, this well-to-do family. Like, this mother was a doctor, right? She had all the resources in the world, but she could not get her son the help that he needed. They did somehow get him into some voluntary treatment, but it wasn't high enough level. He ended up having a psychotic break, and he literally broke out of the facility and was lost in the wilderness for a couple of days because he thought that the care facility was raping the women patients. And then They got him into the hospital for like 11 days, a psychiatric hospital where the mom was advocating for, please give him some medication to break the psychosis. But the hospital said, no, he's not sick enough and he's not a danger to himself and others. Therefore, it's unethical for us to give him medication. So they sent him home in psychosis. And of course, this family brings him home, but he's unwell. And in his psychosis, he believed his mother was poisoning him. And so in the middle of the night, he got up, went into her room, and he killed her.
It was so sad to read that story because his mother tried so hard, like was such a fierce advocate for him getting help, and she still died. And it was so sad. I believe it was her husband who basically said that she had to sacrifice her life to save her son.
Right. He said it along the lines of like, she was determined to get him the help that she needed, but she didn't know that it was going to cost her life.
Yeah. And I know there was another story, Calvin Clark's story, and his mother was actually involved in an Oregon state legislative work group that was supposed to look at our civil commitment laws and assess, okay, how are we going to move forward? And her own son, who was experiencing a psychotic break, also killed himself.
Yeah, he died by suicide prior to the commitment to change, but it was Teresa. Austin killed his mom during the commitment to change work group. And when they brought that up with all of the other constituents, it didn't seem to like sway certain people. They were unaffected by the murder of Teresa Graham.
So who was part of the Commitment to Change CTC work group? Because I know that there were mothers involved, but I know that there was also an advocacy group.
Yeah, so there was a lot of people who were involved in this work group. There's people from the courts, from the law enforcement, from advocacy nonprofit groups, but also families as well. And so, yeah, these families, there's one woman named Jerry Clark who was really responsible for gathering a lot of family input throughout the state and creating that unified voice among families who have this lived experience with children with mental illness or family members that they cannot help. And both of the, families that I've talked to specifically came to me to say, Disability Rights Oregon was a key factor in why they had to water down the recommendations to the Oregon State Legislature because they felt like Disability Rights Oregon was not committed to change. In fact, they were there to try and make it even harder to civilly commit people and get people mental health care treatment.
Dave Boyer with Disability Rights Oregon, he gave you a quote that I thought just sounded a little disconnected from what was happening. I just want to repeat it and just hear your thoughts, what the families are saying after possibly reading this quote. And this is in response to hearing that Austin Graham murdered his mother, who was, again, involved in this work group. He said, people with mental illness, this case aside, are typically not as dangerous as a general population. So I think this case, while dramatic and just tragic, also is so rare, it's difficult to change a whole system based on small numbers of cases. And it felt a little, what's the word? Dismissive?
I think that those two words are the exact words that the parents used with me. They say that there's a disconnect and they are dismissing the reality of these family situations.
Yeah. I'm just wondering, what was the point of Commitment to Change work group? What did they end up changing?
So they don't change anything, but they did put forward dozens and dozens of recommendations, making it more clear where these families are hitting roadblocks. So they did do some, decent work, but the way the governor described it is that's table stakes. We're going to for sure clean up all of the recommendations from Commitment to Change. But Governor Kotek has even said she agrees that they did not go far enough. She's told me that that's why she does support, NAMI's bill to try and make it easier and more clear for how to civilly commit somebody.
Yeah. Okay, well, let's take a quick break here. And when we come back, the two bills hoping to improve our state's mental health care.
CityCast Portland is brought to you by Diamore Law Group. Let's face it, sometimes bad stuff happens. A serious injury, a catastrophic accident, or even a wrongful death. It can turn your world upside down. When it does, you deserve unwavering support from a dedicated team. Yep, you need a lawyer. DMR Law Group has over 30 years of experience protecting the rights of Oregonians. Their team of skilled attorneys, led by distinguished trial attorney Tom DeAmore, will work tirelessly to make sure your voice is heard and your rights are protected. Here's what one of his clients said. Tom fights for his clients from the first day they meet him through the last day of trial. If you or a loved one needs help holding those responsible for your injuries accountable, contact DeAmore Law Group at 503-222-6333 or visit deamorelaw.com to schedule a free consultation. They are committed to fighting for the justice and compensation you deserve right here in Portland.
Are your ulcerative colitis symptoms proving difficult to manage? Tremfya guselkumab can help you manage the cycle of UC symptoms. At 1 year, many patients taking Tremfya achieved clinical remission, and some patients also achieved endoscopic remission. Individual results may vary. Tremfya is a prescription medicine used to treat adults with moderately to severely active ulcerative colitis. Serious allergic reactions and increased risk of infections may occur. Before treatment, your doctor should check you for infections and TB. Tell your doctor if you have an infection, flu-like symptoms, or if you need a vaccine. Ask your doctor if Tremfya can help you manage the cycle of UC symptoms. Call 1-800-526-7736 to learn more or visit tremfyaradio.com.
So walk us through the proposed bills. Like, what do they entail? And who is behind them?
Yeah, so the National Alliance for Mental Illness, Oregon, is the one who has put forward these bills. They are another advocacy group that help advocate for people and families who are affected by mental illness. So they have House Bill 2467 and Senate Bill 171. Here's kind of like an explainer of what these do in conjunction with one another. Oregon's law, like I've said, uses really vague terms like danger to self and danger to others. And then that leaves, when you don't say anything else, it leaves it up to the courts to interpret it.
Mm-hmm.
Over time, these rulings have really tightened and raised the bar for commitment criteria, which NAMI argues has worsened the mental health crisis. So NAMI's proposed legislation aims to clarify and then improve these civil commitment standards by doing things like defining danger to self and danger to others with specific clinical criteria, setting clear guidelines for what serious physical harm means, as well as basic personal needs, kind of like I described in Pennsylvania and what, Utah does. And then to handle the increased service demand, because if you make it easier to commit more people, then you need places for them to go. Otherwise, that's also not good. So they're also pushing for more facility-based and community mental health care options. So basically, in short, one bill would make it slightly easier to get somebody into involuntary mental health care treatment and not wait until they're about to kill themselves or somebody else. And then it's companion legislation that really will make it easier to develop and operate these new licensed residential mental health care facilities.
Which we don't have enough of.
No. So in the last biennium, Oregon has invested like over $1 billion in trying to stand up some more beds and treatment facilities. But those take time and they need a workforce behind them. So that is one of our hardest barriers to overcome. We already know that our healthcare system is strained as is, let alone needing some of the hardest healthcare workers, right, and the hardest jobs in mental health care. So that's still in the works right now. These facilities are being built, but like I said, Rome wasn't built in a day.
Mm-hmm. Do these bills have any kind of support among our state lawmakers? Because when I looked at them, usually it says sponsored by, and I didn't see not one name. And I wonder if people are concerned, because I think that a lot of people are seeing this as if you're for these bills, then you're against disability rights.
That's a really interesting interpretation, and that might be the case. Because again, if you look online, I've gone online, there's no chief sponsors listed for this bill, which, typically there's a few people named.
Mm-hmm.
I will tell you that I've talked to Governor Kotek personally, and she has told me that she supports NAMI's bills. Unsurprisingly, there are, of course, people within our party that do too as well. Lisa Reynolds comes to mind. But then I also had the chance to talk to House Republican leader Christine Drazen, who also has an appetite to discuss and change civil commitment. She's also extremely outspoken about putting families' voices first. But I will say, like you said, this is not a slam dunk. This is an extremely controversial topic.
Man. Well, before we dive into what some advocacy groups against the bills are saying, is there clear data showing that these bills are needed? Because, Right now, the stories that we heard were very personal. My feelings about it are very personal, but like, what does the data show?
So one could argue, yes, there is data that shows this. So in 2023, Care Oregon and HealthShare Oregon, which are basically like insurance companies, they provide Medicaid to more than 1 million Oregonians. They did extensive research in 2023 to calculate the cost of untreated mental illness. Not surprisingly, it's exorbitant in terms of the cost of overwhelming emergency rooms, 911 first responders, public defenders, courts, jails, and then the fallout of property crimes and person crimes, right? That's kind of like all of the stuff that's permeating in society. So the cost of not having high-level mental health care facilities and community-based treatment is now well documented, especially in the Tri-County area. However, one can still argue that making it easier to force somebody into mental health treatment isn't the answer to the crisis.
How so?
Well, so for instance, Disability Rights Oregon is one who is outspokenly and has for a long time has said that they are against expanding civil commitment laws. And their main argument is that it is costly and an ineffective approach to addressing issues like chronic mental illness, homelessness, and addiction. They emphasize that civil commitment is the most expensive way to care for the fewest amount of people. Basically, they say that, you could care for 100 people in civil commitment where you could care for tens of thousands of people in other ways who are, vulnerable in the community. They say that Oregon is spending approximately like $300,000 to forcibly commit one person for approximately 6 months. So instead, what Disability Rights Oregon is advocating for is to instead investing a lot of money in preventative solutions in community-based mental health care services to address the root causes of the illnesses so people never get to the point where they need to be forced into treatment. But I want to hear your but. I want to hear your but because I've got a but too.
Oh my God. Well, but there is no amount of community care that would have, speaking from personal experience, saved my brother. That is something that you are born with, and it is a mental disorder. It doesn't come from your community not caring enough for you. And I just have to explain it that way because we had to look at it on so many levels. We've been dealing with my brother's health for 30 years. And there's just absolutely no way that any kind of art therapy or any, you know what I'm saying? That's not the way that works. It's like saying, it's like saying manic depression. It's like, if you can allow people to be depressed and how that works and your brain chemistry, then you have to also allow for schizophrenics to that's their brain chemistry, Sorry, Elise, go on.
No, that is every time that I say, this is what Disability Rights Oregon says is the solution. So many families who have lived experience with this say exactly what you're saying, Claudia. They say, but my child is one of the most severely mentally ill individuals with anosognosia, meaning they don't even realize that they're sick. And the longer somebody stays in the state of psychosis and or in a schizophrenic state, it causes brain damage.
Oh, man.
You know what I mean?
Yeah.
So when mothers and fathers are asking, let's get my child some medication to break this cycle, that's why they're advocating for that, because they don't want them to get further
damaged. And I have to attest to that because my brother at this point has tremors. He wasn't born with tremors. It's just that every time he has a schizophrenic episode, which lasts for weeks occasionally, and we can't reach him and we can't force someone to seek help unless you civilly commit them, which is what we're talking about. He comes back just a little worse. It's like, imagine you had a stroke. Like, that is kind of what's happening. And like, I've never thought about the words for it, but it's like, oh yeah, he comes back worse. And it's painful just to see, because literally what we're waiting at this point, we're waiting for him to die.
That's what so many families tell me, that they know that their loved one will not be able to recover. And so they're just holding their breath.
And it's because of all these well-meaning, compassionate laws that don't work for a specific group of people and that you have to allow for them to exist too. The opposite of what they're trying to do is happening. It's like, actually, you're really excluding a big chunk, and it's not one or two people. And here's the deal. There's so many more that's not getting reported because families, weirdly, they feel shame. It's like they're embarrassed because they can't get help. You feel like a failure. You're just like, I can't love someone hard enough to fix them. You feel like a failure as a family.
I mean, it's incredible to me how all of these families don't know each other, but use the same words, have the same feelings and experiences with this kind of like loss, because your brother's still here, but I feel like you've already like grieved him in his life.
Because we just know it's a cycle and he will never get help. And this is the deal. He lives in California. California is exactly the same way.
What I found is if you go to one extreme right or one extreme left, the further you go to the extremes, the closer those extremes come together, And so while Oregon, one thing that I will say is that Oregon has a really dark history of abusing people's civil liberties and forcing people into treatment when they weren't mentally ill, or even practicing eugenics, like AKA the sterilization of people who they saw was unfit to reproduce, as recent as 1981. That is real. We have to acknowledge that. That is our dark history. But many parents who I've met in the last 4 years say they agree that the state needs to be very careful when we change civil commitment laws, but they feel like that pendulum has swung in the complete opposite direction.
It's the overcorrection.
There you go.
For sure. And that's what it feels like. But let's go back to the numbers that Disability Rights Oregon presented, because that's a really convincing argument. Like that is, if that's what they're saying, was that at all verified?
Yeah, so I was able to go through some information from the CJC, and yes, the numbers that I put out in my article are cross-referenced and verified independently from Disability Rights Oregon. So it is no lie. Involuntary treatment is extremely, extremely expensive. NAMI Oregon will be the first to tell you, like, if we were to make it super easy to civilly commit anyone and everyone, that Oregon would go bankrupt, before you could bat an eye. But parents will argue that there's the hidden costs of like ERs, jails, courts, right? That we're not talking about here. But also, like, for instance, a mother was just recently awarded $4 million here in Oregon because her child was in the juvenile justice system asking and begging to go to the state hospital because they were experiencing hallucinations, and it's all well documented in court records, but they did not get that person the health care they need, and that child died by suicide. And so, again, that's another hidden cost of paying out families who have been mistreated. So in short, even if we don't civilly commit people, we are paying the price of untreated mental illness and all these different facets of our society.
It's kind of interesting if you were to follow the care that someone is getting, someone with severe mental health disorders, because it doesn't end in the state they live in. Let's just put it that way.
Yeah.
We have gotten calls about my brother from Michigan just running naked on the freeway. We've gotten calls from him in Texas. And we're just like, how did he end up in Texas?
That's unbelievable.
So if you were to follow how much one single person is costing, like all of these states that they are having schizophrenic episodes in, I don't know. Like, I wonder if the numbers would line up or what's going on. But the truth is it's about the care, because I believe it was NAMI who basically stated, like, yeah, Disability Rights Oregon is right. Civil commitment is not the ultimate long-term solution. It's basically like, let's get them on a program, on a regimen to break the cycle. And literally to keep them away from having a criminal record. Like, if you really care about people and their future, you don't want them to have a criminal record. You don't want them mixed up, like you were saying, in juvie or in our state prisons. Like, that's when they're lost.
Right. And so, like, parents are saying the pendulum has swung in the wrong direction to the point where we're now leaving mentally ill people to suffer on the streets, to die by suicide, or to murder their mothers. That's
an extreme. But yes.
That's an extreme. But Disability Rights Oregon clearly says that no one should ever be civilly committed. The reality is, Claudia, Oregon is civilly committing hundreds of people every single year to the state hospital, but they're only doing it after people have committed crimes in their mental illness. Currently 96% of the patients at the Oregon State Hospital are there because of criminal matters. It took them committing a crime to get mental health treatment. And so with these new bills, NAMI is just saying, let's get people mental health care that they need and keep them from that burden, like you mentioned, of a criminal record on top of their mental illness, because clearly that's the last thing they need.
Yeah. Well, Elise, thank you so much for taking the time to report on this. I mean, to be honest, this was one of the first few articles about this topic where I just was like, oh my God, finally somebody is talking about this in a way that holds more than just the argument of civil liberties.
Yeah, one mother told me that, her son died by suicide. She's like, we're not leaving them in their freedom. We're abandoning them in their mental illness. And that's how she sees what's currently happening in our state.
If you or anyone you know is struggling with thoughts of suicide, please call the Suicide and Crisis Lifeline at 988. There's help available 24 hours a day. And if you or a loved one is struggling with mental illness, NAMI Oregon's helpline is 503-230-8009. Well, that's all for today here on CityCast Portland. Thanks so much for listening. We'll be back tomorrow morning with more from around the city. Until then, see you at Slim's.